here.
You don't want us here already? All right, we'll call to order the meeting. Chuck and Jim will shortly join us, I'm sure, but we'll start with the website update.
All right, this is Sarah Morley, who's probably going to do it, and Joe Chilada is the managing editor of the Register as well. My sister and I were down here, this is our second go around at looking at this, for something that we might be able to lock into. It is $500 a year, and what we were thinking is that if we could get 12 volunteers to do it on a monthly, pay it on a monthly basis, we don't have to come and ask people. So, Sarah, I'm going to leave it to you to show it to them, okay?
Hi, I'm Joe Gillardin, and I'm the executive editor of the Boothbay Register and a faithful patient of Nancy Oliphant.
Thank you.
I'm in a crazy business right now. I spent 36 years with the Indianapolis Star as a reporter and a columnist and a general troublemaker. I came up here because I married a gal from East Boothbay, and she told me, when we retired, she said, "I'm coming home. I hope you come with me. But if you don't, I'm going anyway." Danny and Shirley have known my wife since she was a child, and they know that I am telling the truth. That's the way she is. We have different ways of getting the paper to you. One of the ways is with the Postal Service. The Postal Service is not very good anymore.
No.
So our friends who are snowbirds take the paper, and I keep getting phone calls from them because they don't get the paper. And there are lots of people don't read the paper as much as they did. My kids don't, maybe your kids do, but that's just the world we live in. So we spent a great deal of time this year putting together a website to let you see the news on a daily basis on our website. This is basically a daily newspaper that we're running on a computer. And this is what it is. It's on Sarah's computer. And here are the stories. And we run through it. You can click on those stories and see what's going on. I'll tell you how it works. Monday afternoon, did anybody feel the earthquake? Yeah, everybody did. My wife sent me downstairs and said, "Check the furnace. I'm sure the furnace blew off." When it happened, one of our reporters ran outside because he thought surely somebody had driven a car into the building. And when that didn't happen, he started making some phone calls. That was at 1:19 in the afternoon. At 2 o'clock in the afternoon, we had a story about the earthquake up on the website. And it told people what happened. By 3:30 in the afternoon, 600 people had looked at that.
Wow.
By this morning, it was over 2,000
Wow.
had looked at that story on that website. They clicked on it with their computer. Now, we could put it up, but what we have to do is figure a way to make money out of it. Because, quite frankly, the subscription you pay for your newspaper does not pay me to pay the kids that put it together, or to pay the cost of transportation or printing. But we've got what's called a business affiliate program that Sarah's going to tell you about, that for very little money, you can actually purchase or rent a microsite on our website, so that everybody that looks on our website for news can click on your website and you can get your information out. So you can communicate with your friends and your members and even your political constituency, if you want, through our website at a very low cost. And I'm talking $20 a month.
How much?
$20 a week.
There's two different
There's
prices.
different prices.
It's
but I mean-
$9.95 a week for nonprofits,
Okay.
charities, and then for businesses.
How about cheap politicians?
For
Cheap politicians, cheap
cheap
politicians.
politicians, it's like $50 a week.
We have a special rate for cheap politicians. But that's, it doesn't cost very much money, and it'll allow you to get your message out.
Joe, does this also show up in the Wisconsin newspaper?
Yes.
You bet. You bet. And so,
If you click on our link or whatever it is
Yeah.
we've got there, does that open us up into a page
we'll
of our?
show you exactly what it does.
So,
And now this is Sarah Morley. Do you all know Sarah?
Yeah.
Sarah's a native, I am not, so she's to be believed.
I was born at St. Andrew's Hospital. So how it works is when you become a business affiliate, all of these listings that you're seeing right now, they're all affiliates because they have a logo next to their name. And the affiliate program gets you your name, phone number, address, an email contact, and it also gets you your own site within our site. So if I go down, let's just go to the Y, for instance, and click on the Y. This is their micro page within ours. And you get their logo, ours. You can put, they've got holiday closings in there. You have a lot of space to put whatever you would like. Phone number, mailing address. You can also I have Fisherman's Festival on here so that you can put donations can be mailed to if you want to have that be the address that people see. And you get a primary image, which is up here. This they chose to put a photo, but this is, you actually will get an ad that you can put whatever you would like in there. This ad rotates, all of the affiliate ads rotate down under our news stories. So when someone clicks on an article on the website, they are rotated, they will be at the bottom of the site. People can click it and it will bring you back to your microsite. It has a join us on Facebook link, and this is where it's really exciting, is you can click on the join us on Facebook, go here, people can like your page that might not necessarily have seen your Facebook page and already liked you. Make sure I don't, sorry. And if I want to share this whole page with my Facebook friends, all I have to do is click up here on the F, and it's going to bring up this link. I'm going to click share link, and now all of my friends have this affiliate page. So when they go to it, they'll click on it, and it will bring them back to this site. Down here, you'll see that there's a map. You can have a Google map that GPSes to the facility. You have a small photo gallery. When you put a photo up, some of these, I know it's probably hard to see, but if I scroll over Brian, it says Family Matters at the YMCA. You can give text to the photos, and you have unlimited amount of small photo gallery. And then if we scroll down, there's a large photo gallery. And down in here, you can also add video. If you want to add, if you have video, you can put it in there. You can also add links to video if they're important. You can add links to specific sites or documents if you would like. If we go up in here, this is where it gets very exciting. You have the ability at any time to go in and make a post. And if I click on, this is one of their posts for the turkey trot. And this is specific, as you can see, this is specific for the Thanksgiving Day turkey trot that they held. They added a photo. They did not have to add a photo. They could just have put text up. They could put a video up next year. They have video now. They can add a video to this and show the brochure, tell about the turkey trot, and show video of last year's turkey trot for people if they're interested. Where the posts show up are on the sidebar of the site. On all of our pages, you'll see this Main Street Dine and Shop, and these are all posts. So, sorry, it's hard for me to see. Today, for instance, if I go down to this post, which is old, but today in the deli, you would click on that. This is a post for a private group. They don't have it up there, but they've made a post, they've added a couple photos, a little text, and they've also added a link that you can click on, brings you directly to a site. I'm going to go back to find local business, and I'm going to go to our site. And here's just another example. We have a full website, so we have Like Us on Facebook to send people there. We also have a link to our summertime guide. You can click, send you to another website where we have our summertime guide. And then we also have attachments, and this may be helpful for you is if you have a PDF of any documents that you want to get out there, you can keep them under the attachment section. You can get them out as posts if you would like, daily. And one person can have access to the site, or 20 people can have access to the site. And any of this can be changed at any time by whoever has the password. It's really very simple. If I can do it, anybody can do it. It walks you right through it, and you click save, and it just happens. It's really, I refer to it like the Jetsons. Again, this ad here will be rotating down under our news articles, and I'm just going to click here under the attachment to show you how that would come up. This is where it'll be beneficial for documents. Hopefully it will open. Is it trying? Maybe not.
Sometimes it takes magic.
That's a bad look at it.
Wireless signal on that side of the building isn't great.
Oh, good.
So-
Okay, there we are. Okay, so let's try. See if we can do this. Okay. So this could be any document that you have to turn into a PDF. If you have anybody that has a smartphone, you have the ability, if you have something that you want to immediately get on as a post, we do it all the time. We take a picture of it, put it up as a JPEG, as a photo, and get it on. It takes about 2 minutes to do it, so you can get stuff out as soon as if there's breaking news, you can get it up there immediately. And probably the last thing that will really, sorry, I have to get back here. The last thing that will really be important to you is at the bottom you also have the ability to put stuff on our calendar of events, upcoming events. So if there are meetings scheduled for a specific time, you can go in, enter the meetings, and schedule it to post a couple days ahead of time to remind people. You can schedule it to post every day, reminding people of meetings coming up. And I think I pretty much touched on everything without taking up the whole
What would our address be?
meeting.
How would people find us?
You go to the website and register.
Yes, you go through the register, you come here,
But if somebody's looking for St. Andrews
they
Task
find local
Force and they
businesses.
Google it, would it take us into that?
We're hoping, the hope is the more people that we get on, the more it moves our site up, so that if somebody does type in St. Andrews Task Force, it would bring the Boothbay Register to the top, and they would click there. This is where you're gonna get it out the most, is on the posting. It's really important to have daily posts that get your name out there, so that people click on it and go to your site.
What about the search? If somebody searches, right now, for example, the Boothbay Register, if I search on St. Andrews, I get a kind of a confusing list of stories, like it's not clear what order they're in. And
You should see them when they come in.
so I'm wondering if we have the St. Andrews sub-site, task force sub-site, then microsite, are we gonna turn up when somebody does a search on St. Andrews?
That I don't know.
I don't know that
I
either,
don't know
so
the
I'll
answer
find
to
out
that.
for you.
I know that it brings up the stories, but I'm not sure about the,
This is a work in progress that we're doing.
Right.
And if anybody's ever tried to build one of these crazy things, you know that it's all by guess and by
It's
golly.
great. It's great.
And that's what we're doing.
here's Fisherman's Festival, just to show you on the list. We have donations can be sent to, and we have a P.O. box for that. It would be something that you would have to collaborate and choose who you would want to be a contact, you know, who would like to be the primary person that gets emails.
Do any of these people have a link through PayPal, do you know?
Well, we just set these guys up, and they're still working on their, they'll probably get nuts, but we just set them up, and they're an e-commerce site. And what they're doing is, there aren't any here now, but they're gonna do posts that have links directly to, they can do a post selling a baby bag. And when you click on it, it will take you to their paywall to buy that baby bag.
So in like fashion, we might be able to set up a donation thing through something like PayPal.
Yes, you absolutely would be able to do that.
Sarah, I have a few questions. What is the number of users that you can have access to your page to make updates?
Right now, there isn't a limit to that. You decide, and there's options to either have one password and username that you distribute to whoever you want to give it to, or everybody can be set up individually. We do have to set them up right now. So if there are 3 people that need to be a user, you would just have to call, and we would have to set them up with a new username and password. Once we set it up with a username, you do have the ability to change it. So we set it up, it gets you into the site, and then you can make your own username and password so that nobody else would be able to
So, in a similar question, do you offer support if people have questions for how to do something? Can we just call you?
Absolutely, and I tell people, you know, if you're really busy and there's a new document that's come out and you really want to get it on as a post, just call us, shoot me an email. It takes like 3 minutes and I can get it on there for you. That's, you know, not a problem. You know, we can't oversee the site completely for you and do it all just because there's so many. It would take up the whole week, but.
Do you know how many you have right now?
Between Boothbay and Wiscasset, I would say right now there's probably between 48 and 55. There's a bunch coming, working on right now. That'll be up probably by the end of the week. They do take a day or 2 to get up and going.
And if I went to the Wiscasset paper and it says find local businesses, it's the same list?
It's the same layout, yes, it's all the same layout. Everybody goes on both sites, Boothbay and Wiscasset.
We did just do a Google search on one of the businesses that's on the list, and it came up about 12 on
Which
the.
was Cassidy's newspaper.
For Wiscasset, yeah.
Is there a contract that we sign for a full year, or do we pay month by month?
They would bill they bill weekly, just like the paper, and we just get your contact information and get you set up on the computer, and they would invoice it unless we can bill a credit card at the end of the month. And I know Alice had talked about maybe dividing up and finding 12 people to cover each month, and we would be willing to generate an invoice, and then whoever was scheduled for that month, you know, could come and pay, but.
And the events sorry, this is the last question. The events that we can put on the calendar online, do those then get automatically published in the paper version?
No.
Or, so we just,
They don't, it's not an automatic
okay.
thing, but they do look there. They do look and find stuff. If it's something that they don't know about, then they would definitely pull it and put it in the
Don't
paper.
forget your press releases.
Right, okay, so that's still important. Great, thank you.
Anything else?
In the order in which the businesses are displayed, if you go down from the home,
Let me get to it.
how is the order determined? In other words, you have 50 of them.
They're alphabetical.
They're alphabetical.
The find local, if you go to find local businesses, these are alphabetical. All of the affiliates are at the top. We do have business listings, which is just name and address. They come after the affiliates. These are also over here. For instance, if we clicked on accountants and lawyers, we should click and maybe see Tom Barry there. But he's not. Griffin Law Office is. And down here, there's churches, community, organization. You would also show up here. You know, you get to choose 2 categories to be in, as well as the find local businesses. So if somebody is specifically looking.
What pushes the business onto the recent listings?
When you sign up, you're on the recent listing until you get bumped up. You gotta go.
One signs up, bumps one up.
Exactly.
Okay, so
It
just
stays there.
just
Where you
unsign
get out,
sign
and
back up.
I can't emphasize this enough, the most important part of this whole site is posting. Is finding somebody that will put stuff up daily or, you know, at least
Is there a
weekly.
possibility of changing that to maybe the most recent postings will come up on that?
Well, these are the posts that you'll see, if you look under Main Street, you would show up under the shop posting or Main Street Buzz, and those are in order as people post, and they get bumped up.
And you said that.
So the more you do that,
The more you buzz.
the more you're good. The
More you
more you
bu-
buzz,
more
the
you
more
post,
you're
the
up
more you-
there.
Squeaky wheel.
It's
But we
just-
don't really fit in either dine or shop.
No,
So
the shop. I mean, this is not. For instance, Bonnie's under shop. Those are just the 2 categories. Bonnie did a posting thanking Mickey Boudelier. That I don't know from
Special Olympics,
Olympics. She wanted to get something out, and so she's an affiliate, and that was one of her first posts. She put a video up just in kind of his memory, which really isn't a shop per se, but
Right.
you can go there and under Main Street Buzz and under the calendar if it's a specific event coming up or a meeting or something.
This is a work in progress. We're working on it. And
We're always open for suggestions.
all suggestions are accepted.
Don't say that in this room.
Yeah, we do. Believe me. What we're trying to do is take an institution that was founded in 1876 and make so it'll be alive in 2076. There are newspapers closing all over the country right now. This is no secret in my business. The New Orleans Times-Picayune, one of the great newspapers in America, is down to 3 days a week. The Cleveland Plain Dealer is going the same way. They're putting up paywalls, so you have to pay money to click on these things. You want to read something on there. Our site is FREE. But we got to have some way to pay for it.
And I forgot one thing very important, is the posts, one of the major parts of this is that there is a Facebook page, and the posts can all be shared directly to Facebook, which gets you that many more viewers, because not only we have 27,000 people viewing the site a month right now, and it keeps growing. And we also have 1,663, I believe, this morning, Facebook friends, and that's increasing, 10 at a time each day. So when you share, you're going here, you're going to your Facebook page with however many people you have that like you on Facebook. We share your links. I share all of my customers when I go on. I share with my friends, and believe it or not, I have like 390 friends. So they all see it, but it really, it's like a branched out tree. It just keeps going, and it just gets you that many people that view. We have 1,663 Facebook friends, but our posts are being seen close to 4,000 times when it goes on our Facebook page. And that's because those people are sharing it with their friends who are also viewing it. They may not necessarily have liked us on Facebook, but they're still seeing it. So it gets out there, and instantly after you do one post, it's getting you out to more than 1,000 people, over and above the 27,000 that are seeing it per month here. So
Besides, and for the same price, without a shipping and handling charge, you get the weather. You get this without the TV guy. You get the tides. Okay, go on down. You get
photo gallery.
We get obits, and then you go on down to the really cool thing, all the way down. Where is it? No, that's it. Go on down. We've patched into the DOT traffic jams, so you know that if there's a traffic jam in Wisconsin.
We all know that. The answer is yes.
Can we find out when there isn't any?
All you got to do is look on the website and see the cars. That's a special feature that we stuck in there just for Miss Barnes. She worked so hard at that.
That's great.
So,
Thank you very much.
thank you for letting us come talk to you. Did you see that good-looking basketball player right there? I wonder who she's related to. Thank you very much.
Thanks. Okay, we'll move on to reports. First under reports is the Ivantage report status. Rick?
Thank
you, Chuck. As was noted in the Register last week, there was a meeting, this was last Thursday, of a group of people to review the first draft of the Ivantage report, which, for a bit of history, is Lincoln County Healthcare asked a company called Navigant to produce for them a consultant's report about a year ago to help them determine their strategic path going forward. That report is really the basic premise to how we got to where we are today in this group and the closing of the hospital and so forth. So therefore, it was deemed appropriate for the task force to go out and find another group, perhaps, to give us what we're calling, as well as the Ivantage report, a second opinion. Just find out what, if somebody else, a consultant, could look at it and see did the data in the Navigant report, which is over there for anybody's perusal if they so desire, if that data made sense, if another group looked at it. That the first draft of their work was presented last week. As one would expect, since the Ivantage people work with healthcare executives for the most part, it was found that the report, which has some very interesting information, contained a lot of healthcare jargon, information that needed to be interpreted. Now, since this is ultimately a community report, something that the community has to look at and understand, it was thought that perhaps we should take a couple more weeks, spend some time revising some of the language, and making sure that anybody that picked it up, regardless of whether they'd spent their entire careers in healthcare or not, could get an idea of what these people had come up with. And so therefore, we hope to have the final draft, and after working with them, as of today, we're in draft 4 already, we're moving through this. We hope to have this whole thing completed by the end of the month, and then we'll all be able to look at it and understand this second opinion. So that's the idea, and that's essentially where we are with that report. Are there any questions?
Rick,
Yes.
would it be possible to get like a one-page, very simple summary that could be sent out with letters?
The part of what we're doing is just developing an executive summary,
Okay.
so that everybody will have
Small,
that.
that it could be sent
And,
out.
yeah, it will be available, that executive summary. Thank you very much.
Thank you, Rick. Next under reports, the Community Hospital Work Group. Patty?
What I'd like to do is give you guys an update on the last site visit that we did, which was actually a phone call. As you know, we've been visiting the other critical access hospitals in Maine. And I think we reported at the last meeting we had visited with 8 of them. And then since our last meeting, we had a fascinating phone meeting with Arthur Blank, who's the president and CEO of the Mount Desert Island Hospital. And it was so interesting to us because Bar Harbor is very similar to Booth Bay Harbor in many ways. And they have done some pretty amazing things there. So I thought it would be useful to just kind of give you a few of the quick stories that he told us about what they've done at MDI that I think you'd be interested in. The first thing, in terms of comparison, they have 10,000 people year-round, and their population grows 4 times in the summertime, which he said, by the way, was similar to Martha's Vineyard and some other places that he had spent time. And they are 25 miles from the Ellsworth Hospital by road. So that's kind of their closest other hospital. There were 2 things that the first thing you see when you look at their website is, and talk to them, is this is like the dream hospital for a small rural community. It is very, very well staffed. They have all these different specialties represented. It's a beautiful facility. And it just kind of makes you drool. It's like, well, why can't we be like that? That would be pretty neat. And there were 2 things in particular that really got our attention. One was their behavioral health services. I think you remember that we've talked a lot about mental health needs on our peninsula and how underserved they are. And at Bar Harbor, they have 2 or 3 full-time psychiatrists, including an adolescent psychiatrist, on staff. They have 2 psychologists, and they have 4 social workers. And we said, how did you do this? How did you manage to create this very robust outpatient behavioral health thing? And he said, well, we'd love to tell this story. It's just like the way things happen in all of these communities. We had, he said, a guy on our board who was a bicycle, loved to ride his bike, And in the summertime, he volunteered his time at a local bike shop. And one of the guys who came in to get his bike fixed turned out to be a guy who was on the board of the University of Pennsylvania Hospital and was involved in philanthropic, basically raising money for the Penn. And they got to talking about the hospital. It turned out he had just been in the ER himself, some bicycle accident or whatever, and he was very impressed. And so they began to talk, and he said, maybe there's something we could help you with in terms of fundraising and so on. We know quite a bit about that. And so they agreed they would get together, and they got a little group together of 4 people, the CEO, the board member, and then it turned out 2 people from Philadelphia, this gentleman and a local psychiatrist who summered there. And they spent some time talking and realized that they could, in fact, start a psychiatry department at the hospital. All they needed was a little funding to do that, to get going. And so they got $250,000 from 2 brothers who summered on the island. And that was enough to kind of bankroll the beginning of their pilot project and put a business plan together. And now they're at the point where, and the way he said it is, we quickly built it, and of course if you build it, they will come. And he says, we now see roughly 1,600 patients a month and 18,000 a year. That's actually serving the whole region, but in particular this community. He said it could keep growing, but he said we do have to subsidize it. Doesn't pay for itself, and we manage to subsidize it every year through donations and grant money. So about $350,000 a year is what it's actually costing them to run this very robust service. But they do get reimbursement from Medicaid, Medicare, and commercial insurance. And then one other thing he said that was very interesting in terms of best practices was, he said, when you're serving this population, one of the biggest problems you'll have is a very high no-show rate. And he said our no-show rate was about 30%, people who would make appointments and then not show up for them. So what they've done has been very aggressive at working on that, not only calling people up ahead of time to make sure, but also essentially having a waiting list and being able to backfill. And now they're down to about 10 or 15% no-show rate. And he said really what led them to this whole awareness was their primary care physicians who were reporting that the largest percentage of patients they were seeing really weren't suffering only from physical ailments, but they were suffering mostly from depression. And they really felt they needed to get out in front of it, and that this was a major problem for their community. So I thought that was definitely worth reporting. And then the second thing they did, which also relates to the University of Pennsylvania, actually this was a doctor from Lancaster, a psychiatrist from Lancaster who helped them start, because Lancaster, Pennsylvania used to help them start. The University of Pennsylvania connection started with the bicycle shop and ended up with a program that started in 2011, which is a training program. So basically what they discovered was that when they started talking to the University of Penn about how could they work together and what would be beneficial win-win for both institutions, the hospital on Mount Desert and the big teaching hospital in the middle of Philadelphia, they realized that, well, they have a lot of students and interns who need to learn about, or want to learn about rural medicine, and they had no place to send them. So they decided they would try a pilot program in 2011 of bringing a team of 3 people, a 3-year resident, a nurse, and an intern for 2 two-week rotations, two different groups of 3 people, to come up and basically practice rural medicine in the emergency department at MDI. And so the first summer, 2011, they did it for a month, these two groups of two. The second summer, they did it for 2 months, and they had 4 groups of 3. And now this summer, they're going to have the whole 3-month period covered. And that now they have people raising their hands and saying they want to come. So basically, in the summer months, their emergency department is staffed in part by these teams of 3 that are coming from one of the best teaching hospitals in the country. And then they also, part of their rationale for Mount Desert is to train the nursing staff at Mount Desert about these emergency department procedures that they really need to learn. And so they've now put up a training program, and they get a 1-month internship in Philadelphia, where they go down to the University of Pennsylvania and they actually practice in the emergency rooms in the big city, and then they come back. And they said this program has been so successful that they're now looking for other hospitals, rural hospitals, that would like to.
On the coast of Maine.
So we're pretty psyched about that. We thought that was a pretty interesting, 2 pretty interesting examples of very creative thinking. And of course, part of it did need fundraising. So they have, again, donors who helped fund the University of Pennsylvania program. But interestingly enough, those donors are from Philadelphia. So what they did was they put together a consortium of 12 people who are associated with the University of Pennsylvania who actually put money in a pot to fund this pilot program. So they got $2 million to pay for this first 3-year process. And now they're going back out. They said part of this year's funding is help pay for a grant writer so they can try to keep it going. But he said they're also going to go back to the original donors and get them to ante up, hopefully, for some more. And then the final thing, just in terms of the financing, that we thought was I thought was pretty interesting was, these, you can think that they're rolling in money, but it actually, he said that when he got there 15 years ago, they did very little fundraising at Mount Desert. And he wasn't when they hired him, they said, you have 3 things you need to do, and the 3rd one is fundraising. And he said, well, I know how to do the first 2. I don't actually know how to do that, but I'll do my best. And obviously, he has done pretty well. But one of the ways that he does it is they do a lot of capital campaigns. So basically, they get people to invest in buildings and capital equipment and so on. And then the way he puts it is 70% of our capital spending is donor funded, and then we use the depreciation that's cost reimbursed to fund our operating losses and the behavioral health services. So I think that's a pretty creative, and by the way, he's a CPA, so he kind of turned the funding upside down to think about how to get it done, and that's worked really well for them. And then he talked about the fact that each year they're raising another about $900,000. Or actually, each year they're spending about $900,000 a year in additional money that comes both from the capital campaigns and from the unrestricted donations that they get. But their endowment is about $2 million. It's not astronomical. So anyway, that's, I think, the most interesting thing to report from our work this week. Yes?
Do they do most of their lab work there, or do they send it out, or courier it, or?
I think they have, I'm pretty sure they do all their lab work.
And x-rays.
And they have an infusion center which does chemotherapy. They have an oncologist who comes once a week and actually lives on the island but is associated with the cancer center in Bangor.
Mm-hmm.
So they have, as we saw with a lot of the other hospitals, they have a lot of specialists who come to do clinics, once or twice a week. And then and then the other thing, their emergency department is run not by board certified people specializing in emergency medicine. It's actually staffed 24 hours a day by physician's assistants. And then 10 hours each day, 7 days a week, there is a hospitalist who covers the emergency room and the rest of the hospital, which is another pattern that we're beginning to see elsewhere. So during the daytime hours, they have a hospitalist, MD, they have physician's assistants and of course nurses in the emergency room. And then at night, they have physician's assistants and they rotate people on call. And the doctors on call, they have a pediatric group on call, they have a regular set of doctors, adult doctors on call, and they have maternity people on call. And they have no OBGYNs, but they do about 1,000 births a year. And they do them with their primary care physicians, are the ones who come and attend. Any other questions? They have, they're not affiliated, they're certainly not a wholly owned subsidiary of anybody, as we are. They do have a loose affiliation with Eastern Maine, which they use for their teletrauma and tele-ICU. So if they're in the emergency room and they need a consult, particularly, they said it was particularly helpful with patients who they know are going to need to be transported, say a cardiac problem or something, and they know they're going to need to go to Bangor or someplace that has special care. They'll be on the computer, consulting with the physician who's actually going to, the specialist who's actually going to be taking that patient in. And they said that works really well to make the family and the patient feel really comfortable about that transition.
Once again, Patty, outstanding. Thank you so much.
Pretty interesting.
Just related topics to the community hospital report, if I may. I had a meeting, kind of an impromptu meeting today with the Attorney General. I was trying to see her to set up a meeting with me and Jim Chaosis, and she said, no, come on in now and talk because I've got a few minutes. So I had a meeting with her and with the Assistant Attorney General, Tina Moylan, who's aware of, I think you all have met with her. They're under the misimpression, in my opinion, that Maine Health has not yet made up its mind about this. They said, that is not true. They said, can you send me some documents to show why you think that is not true? I haven't really saved a lot of documents. I think some newspaper reports. I think even the handout that's down at the hospital now says we're going to close it on the 1st. So there's no doubt in my mind that they are wrong. And they said they can't do anything until they know that Maine Health has made their decision. They think they're still in the process of thinking they might or they might not. I said, that's not true, as far as I know. If that were true, I'd love to know it. I think they have made up their mind and they're going to close it on the 1st. Unless, until we prove them, wrong in some way that we have not yet managed. So I need some evidence to help them with. If you've got any newspaper clippings or anything else that you've saved that, for example, I remember Pete Mundy said, right after the change to October 1st, he said, well, this doesn't mean that we're not going to close it. We're going to close it. So I need any of that. I can ship it off to them. I would say that I was not either encouraged or discouraged, and I think we will still set up a meeting with other members of the task force. I didn't have all the documents with me. It was an impromptu meeting, but anyway, I think we can disabuse them of the idea that there is an open mind.
That won't take long.
That won't take long, but they just need to know it. I don't know where they got that idea.
Probably from Maine Health.
Yeah. Secondly, the community hospital bill is in the final stages of drafting. I will probably have a bill to bring to I can't be here next Tuesday night. If the bill is ready, maybe I can somehow get it to you all to take a look at. You get at least one crack at it to change it. Probably 2 weeks from tonight, we'll still have a chance, so if I bring it then, that might be the right time.
Just so you know, we don't meet next week.
Pardon?
We're meeting every other week.
That's right, sorry. So
First and third.
in 2 weeks, I'm almost certain we'll have a community hospital bill to look at. It's based upon, the language is almost entirely plagiarized from the language that set up the Mayo Hospital in Dover Foxcroft, and that is the hospital that Ralph Cabarro, who is now our consultant, that's the hospital that he ran, the community hospital in Dover Foxcroft. So, you know, what goes around comes around. So I'm using that language from the way their hospital was set up to be the model for what we would use, except I'm putting in front of it the requirement that there will be a referendum. In their case, they didn't have a referendum, but I think we should put it out to the people, see whether or not they want to go this way. Of course, the other problem we have is that we don't own a hospital to run, but we're expecting, hoping, believing, moving toward the idea that we will have a hospital to run. This community hospital idea, I think, is a very powerful one that would have given us a very different process and result, I think, if it had been in place when all of this was going on behind the scenes. Community hospital has to operate open and in the public. So I'll bring that all to you. There's some pros and cons. If we go forward with it, I'm going to need a lot of help from a lot of people to get it to pass. And it's going to have to be based upon the faith that somehow or other we're going to have a hospital to run if we're going to, but it's an option, okay? The final thing is I put in another bill to require hospitals in Maine to make their bylaws and their board meetings public.
Yay. We'll get that one passed.
Yeah.
Bruce,
I'll need your help on that too, when that one comes up, to come up and say, here's an example down here in Boothbay of why, when it wasn't public and when it was done, you know, how why we can't get any information from them. This is a good example of why we need them to be public. These hospitals take huge amounts of public money, even though they're private organizations. And yet, they want to hide everything behind the cloak of secrecy. That's not right.
You know what we need for them?
Jen?
Oh, okay. Somebody behind me wanted to say something. Given that, what you just said, Bruce, where are we standing on the legal aspect? I mean, where are we standing with that? Are we just waiting? I mean, is there any work being done? No?
Right now, we're waiting for the Advantage report.
That has to come first before the other.
We need to have a working document with that before we can do anything else further. I mean,
Okay.
Julius is still there when we need him, and I'm sure that he's
Okay.
looking forward to hearing what Advantage has to say as well. But as Rick said earlier, we're working on the draft so that we can all understand it.
Yeah, I know, I
It's
realized
not
that, I
full
just
of
didn't realize that.
healthcare ease.
I mean,
And we really don't want to pay Julius until we need him to be paid.
right,
You know?
okay.
yeah, Bruce, can you just walk through the steps of that community hospital bill and what that would be from beginning to end? I know you've said it before, what the steps would be. You have to pass it through the legislature, then it would go to a referendum in the community. Are those are the only two steps?
Yeah.
Committee first.
Yeah, basically, it would
committee.
come out to some committee in the legislature, either Health and Human Services, or I think that's probably where it would come out to. They'd hear it. We hope they would act favorably on it and send it to a vote in the House and Senate. Then if that were the case, all it would do would be to enable a referendum here. So then the heavy lifting would be, do we want to get our people to support this or not?
Doesn't the bill create the district?
Not the way I put it together.
Oh,
Yeah,
okay.
the bill would create the possibility of the district. The district would only be created with the
referendum of.
4 towns voting to create the district.
And that's a risk, but it's also an opportunity. I mean, why do we want the legislature to create a district for us if the people don't really want it?
Right.
So, you know. So it means heavy work on our part to. So I'll bring the bill to us and we're gonna have a lot of discussion about it if we wanna go forward. If we don't wanna go forward, I won't sign it, it won't go forward. So we have a choice.
Thank you.
Thanks, Bruce. Next under report, data analysis. Mike, anything new? Okay. Volunteer coordinator. I understand. Lou.
For those that don't know me, I'm Libby Dinsmore, and Peggy is having to take some time off to complete some projects. It's actually paying her mortgage and stuff like that, and her grocery bill. So I'm going to keep her seat warm for a few months until she gets back, along with some other people. And we're going to be making some changes. Chris Haskell is going to be doing our weekly, well, I shouldn't say weekly update, but our task force update. Since we've now gone to just having meetings once every 2 weeks, then we're going to do an update the Monday following the actual meeting. In other words, next Monday you should be receiving an update through your email. And then I'll also send out a meeting reminder so everybody will continue to show up here right before the meeting so that you'll get that too. Then one of the other things that we discussed is office hours. And at this time, because of volunteers already in place and everything, we're discontinuing the office hours unless we have somebody that would like to join our merry little band here. And if you would like to do that, then all you need to do is contact me, and you can do that by calling me, and my number is 633-4575, or you can send me an email, and my email address is cldins@myfairpoint.net.
Could you say it again?
cldins@myfairpoint.net. And I'll make arrangements for us to meet and find a place for you. And also, if any of your committees need like stuffing parties or people to help serve at your dinners that you're having and things like that, we will be more than happy to do that, and we can set up stuffing parties here and have a good time doing that. One of the other things that, as I was going through and checking out, like our DVDs that we get from Channel 7 that we have over here in our library, I noticed that some of them are missing. Has anybody borrowed any of them? Does anybody know about that? Okay. If you do check out one of them, I have put a sheet there and asked you to sign them out so that I'm not bugging John and asking him for duplicate copies of things. Okay, questions and comments from the community and volunteers. Several people have asked task force members whether we could get a statement from the task force to include in the update, a statement perhaps about that you're meeting with Lincoln County Health and that things are progressing, or we know that you can't actually come out and give away the store and everything, but is that possible, and is somebody willing to do that?
Sure.
Okay. Should I contact you, Chuck? Okay. Then we have received comments too that we probably need the help of a professional fundraiser. And I realize that's probably a little premature until we actually have a plan, but I think it's something that people would like for us to consider. And then, after watching the weather report tonight before we came here, do we have a weather cancellation policy for the meetings?
This is Maine. Show up.
He's got a blade on his truck.
I guess the answer is no.
I do too.
What I would suggest, Libby, is if it appears that we're gonna cancel a meeting because of the weather, first thing I'd do is I'd contact these three.
Okay.
And then, since you're filling in as the coordinator, I'd fire you off an email that said
Okay.
canceled, and if you could disperse it to
I
your
could.
email group.
Yeah.
You know, in Edgecombe, if the school is
Yeah.
there, no meetings. That's how we do it. So, no.
Sad, very sad.
It just makes it easy.
Good idea.
You came to school at the drop of a hat.
That's on Southport, not Edgecombe.
The last thing I was gonna
Sorry.
ask Alice is she wanted to give us an update on the boxes.
I can do that. It'll take about 30 seconds. Right now, we have 22 donation boxes out in the community. I have with me tonight for Jim what I collected between about 2 weeks before Christmas to January 5th. And I have $180.21 that we've collected there. Total, and that's, but now, it's gonna go down now, because after Christmas, the stores close, or some of them close completely, others are only open 1 or 2 days a week. So we're gonna have a lull period here. Up to this date, prior to the money that I have here tonight, we had collected $699.18, plus this equaled $879.39, plus a little money that I'm not quite sure where it came from. This is all in the process of us transitioning information to me. But it looks like totally we have collected up through tonight $1,221.39.
Well done.
Most of which is in nickels, dimes, and quarters.
Thanks, Alice. And Bruce, I'm sure that we can find you some of those clippings that you need.
Okay, that'd be great.
Okay.
As soon as you can, it'd be great.
All right. Okay, that's it.
Thank you so much.
Thank you.
Can I do an update on the
Get rid of
boxes?
that.
Add another $16 that I just got. You bet.
That's right.
Next under reports, BRAS Sports Group, anything new, Robbie?
Nothing new. We're just getting into our budget process with the towns. And everybody, I'm sure, can understand it's going to be a long one this year. We've got some information back from Lincoln County Health and Maine Health from the meeting that was had here with the task force last week. We have a follow-up meeting with the Vice Chairman, Steve Lewis, Scott Lash, and myself with Tim Fox and Dr. Foray on Thursday to follow up on that. But as you can understand, there's many comments and questions about the level of care and the cost that it's going to cost to provide that level of care. So those are going to be the types of discussions that happen. In years gone by, we've had many different budget discussions, but we've never really had the level of care changes that are required now. We put together a budget based on what we feel the level of care is going to be needed and the coverage to the towns. And I think it's healthy that that gets reviewed by everybody. It looks like that's what's going to happen through this group. I think Mr. Smith is part of that as well. There's going to be some involvement from Lincoln County Healthcare and possibly some involvement from some outside EMS related officials in the state, and I'm not exactly sure the complete process of that, but it's gonna be reviewed, and it's gonna help with the budget process, educating the community more, but at the same time, my advocacy is that we need to maintain the leadership of the service in the area, and we need to provide the level of services that the taxpayers want and are willing to pay for. And obviously this year, that's going to be a much larger dollar figure for everybody to swallow, and it's going to cause everybody to ask about it. So I would just say that, you know, if people have comments or questions, I'll answer any questions that need be. Scott's available in the area on Tuesdays and Thursdays. He can answer questions. I just think that the most important thing is to educate everybody, and then we will provide the service that's asked for from the community, and, you know, and we will budget the funds needed for that. The interesting thing with all that is the town meeting in Southport is more than likely going to come up before all this gets ironed out.
You think?
So they're going to be the ones that are going to have to discuss this and make some sort of a town vote on this before all the information is out on the table. But as I spoke at the last meeting, we are going to work through a reporting, probably a quarterly reporting and a quarterly billing for this coming year, so that we can adjust our budget and we can work through this in the process, so that we're not just asking the towns to hand over large sums of money up front. So it's going to be a long process. And if, like I said, if people have questions, call up, send emails. You can send them through the task force. I get all these emails. But, you know, the community needs to be educated, and the community needs to have a say in what they get for EMS coverage and what it's going to cost them to get that coverage.
Is this there regardless of whether or not the hospital is closed?
No. If the hospital does not change its status, we will go back to a budget that's probably within a few dollars of what we asked for last year.
So we're actually asking people to understand a budget without knowing what's going to happen to the hospital.
Right.
Huh?
Correct.
That's absolutely correct.
And that's not fair. I mean,
It's not fair, but it's absolutely reality.
well, I mean, it's like.
It's reality. It's what we're at right now. They don't have a choice.
No, I
you
know they don't.
Yeah, they have no choice.
Well,
A level of service, level of care.
What we have budgeted right at the moment is 2 crews at night, which we do not staff at this time. We staff a 3-person crew at night. The 1 crew is fully paid, and the 3rd person is on a standby basis. Our feeling is that with the requirements that are going to be on our people at that time and the transport times, that we're not going to be able to sustain that with volunteer crews. So what we've budgeted is 2 2-person crews, which is more what's the norm in EMS now, is 2 2-person crews, and if the 1 crew gets on a call and they need extra help, they call the 2nd crew, which is what we currently do during the day right now. During the day, we have an 8 a.m. to 6 p.m. crew, and we have a 6 a.m. to 6 p.m. crew. So part of our budget is increased because of adding those crews. The other part of our budget increase is due to the loss of revenue. But what we're looking at mostly is, what are we going to have to do to provide EMS care to the community in the emergency setting? And our closest mutual aid, depending on where you are in town, is Wiscasset. our second mutual aid that's the closest to the CLC. So if we're at Miles dropping somebody off and there's a second call in town, we can come back just as quick as CLC can come down. But at the same time, that's 20 to 25 minutes, depending on where you are in the community, waiting for an ambulance. And as we've talked in the different meetings before, this area isn't set up with first responders like some of the other areas in the state that have long response times for their ambulances. So we've looked at what we feel the coverage is needed, and that's what we've based the staffing model on. And those are the types of things that we're going to be reviewing in the next few weeks, so that we can, at the same time, we can make sure we're doing it correctly and we're doing it efficiently, and then we can communicate that and educate the community as to what we're going to do, and then at that point, the exact costs of what those costs are going to be to provide that. Did that answer your question?
Yeah, I think level of care, level of service are terms that probably many people aren't familiar with.
Right, and the other part of that, which is a little bit harder subject to understand, but there's different levels of EMT in the state of Maine. There's EMT paramedic, there's EMT advanced, and there's EMT basic. And when this all started, and Lincoln County Healthcare told the community that an ambulance ride from Booth Bay Harbor to Damariscotta was going to provide basically the same level of care that you would get in the first 10 minutes you were in the emergency room. That is based on paramedic level care. So that's the other reason that we have budgeted for the second full crew at night. That's gonna pretty much guarantee that the first 2 pages that go out is gonna get a paramedic level ambulance to respond. And that's also gonna provide the opportunity for some transfer volume, which is obviously what helps offset the budget the most, is the transfer calls.
Thank you, Robbie.
There was a fairly strong statement from Lincoln County Health on the Register website tonight in one of the articles, in which they said that they had consulted with their legal people and that they seemed to be free to be able to reimburse the towns and not go near the ambulance service with any money. Have any of you all heard from them?
It's my belief they're in the process of setting up meetings with each town to discuss what they may be able to donate to the towns to offset some of the costs.
I have an initial meeting scheduled for Thursday.
And Booth Bay Harbor has had a meeting already. Our town manager has had a meeting with them about this, and he'll be presenting it to us tomorrow at the budget meeting.
Mm-hmm.
What came out of that?
So when you're talking to them, and I'm sure you're doing this already, Jim, and for Tom.
I haven't had any discussions.
I think it's important for us to understand whether the offer that they're making is a single-year offer or a 10-year offer.
Any offer that they would be making to the towns would start at a point this year and decrease from there. It's not something.
So it's something, it'll just take the curse off of it right at first.
It's not something that's gonna go on forever.
Continue.
So that sounds really scary.
Right.
Helen Farnham. Answer to, part of the answer for Patty's problem with people not being fair. I really think it's, in a way, our job to get out there and talk to people again. You know, make them well aware if it closes, there's going to be a lot of expense for the ambulance service. And whether they can get everything that they need. And if it does close, we can easily lose our ambulance. And again, I'm a charter member, and I certainly don't want to see that happen. But we need to get out around the public a little more. We have our meetings here, but I don't see a lot of people, in a way, talking. Okay, now you're gonna have your town meeting. Okay, sort of to make it clear, very clear to people, that this is what can happen and what will happen or won't happen. But they need to get out there and voice their opinions. They need to get out there to help us with this. Because everybody here is doing a tremendous job. But we need the help of the public also. Thank you.
I think what's really hard as well is Lincoln County Health not agreeing still to have any kind of open meeting with us.
Well, they're meeting with us.
Yeah, with you. But I mean, you can't tell us what you're talking about. So we don't know.
No, but trust us when we tell you that we're taking your concerns to them when we're discussing everything that's going on.
No, I'm sure. It's just that people, there's only so much you can tell people if you don't know a lot that's going on. So it's hard. I mean, I agree with you totally, but unless you have something really semi-concrete to tell people, your friends or whatever, you know what I mean? You've heard almost everything.
I think that we have certain facts as they stand tonight. The fact is that the emergency room is going to close on October 1st.
That's a fact.
That's a fact. The fact is that the community does not own the hospital anymore. It's owned by Lincoln County Health, Maine Health. The fact is the ambulance service does an excellent job, and they're going to be our saviors in this, but that unless we fund them and make sure that they have the money, they will have to close their doors as well. So, you know, these are the facts. They're not nice, they're not pretty, but this is what people have to understand this. And when they ask you a difficult question, and you don't want to hurt their feelings, you got to stop not hurting their feelings. You got to tell them, here it is. You know, right now, we really don't know the fate of the hospital. We know that unless something changes, we will not have a critical access hospital as of October 1st.
Amen.
That's where we are.
This is why we're doing what we're doing.
Mike?
I might suggest, it might be good to just pick out one salient point from each meeting. And I think the one to talk about tonight is that the ambulance is going to cost the towns $300,000 a year more, which didn't exist.
Probably more than that.
And more than that, well, for around, you know, it's a rounding error in Maine Med's budget. But that's $300,000, that's $100,000 spread amongst 3 towns. $100,000 each town. That's an astounding number. Now, the LCH may indeed say we'll pay it and take the sting out, and it may last for 1, 2, 3, 5 years. However, that is, their money is going to go away, and the towns are going to be paying an extra $100,000 each a year. There's your talking point for this week. It's going to get us right in the wall.
Mike, your math is a little off. I know,
Not
based on population call volume, Southport's would go up from around 8,000.
Around 8 to, I think they were talking near 40.
535,000.
It's in your.
Oh, to 43,000.
43.7.
Boothbay's would go from
32 to 169.
Yeah, and Boothbay Harbors would go from 39 to 201.
So it's not an even distribution.
No, it
It's
isn't.
even more skewed than.
Well, they do it by population,
Yeah, makes sense.
so kind of like the refuge district. we don't all pay the same amount.
Absolutely, yeah.
Do it on population and volume. So,
But a big hit nonetheless.
Yes.
Profound,
Yeah.
profound, not just big.
All right. Next under reports, financial and fundraising.
And, somebody can give.
I have the second opinion, if that's any help.
Yes, sure.
Okay, we need 35,000 for Advantage. We've raised to date $21,785.27. Wow. And we've dispersed 16,625 to Advantage. And basically, what it really comes down to is that we need $13,214.73. That is the bottom line.
Can you say that again? 13,000?
$13,214.73.
And, do you want to present this? Jim has provided us an account status of the account here in the town of Booth Bay. And Jim, thank you, and tell me if I'm wrong on these numbers, if I'm wrong on the way I'm reading them, but we've received $79,063.90 to date, and we have dispersed $63,251.52 to date. Part of those receipts and disbursements were the Second Opinion Fund giving us the money so that we could then pay Advantage from the town of Booth Bay, since the contract is with the town of Booth Bay. It does leave $15,812.38 in the town of Booth Bay's St. Andrews Task Force Fund at this time.
So the bottom line is if we don't get the 13,000, there is money to pay Advantage
Correct.
with nothing left.
With $2,000, $2,500 left.
But fundraising is an issue, there's no question.
So in fundraising news, yeah.
Okay, so we have planned our Valentine's community dinner, which we'd like to raise the 13,700. Probably won't, but we'd like to. It's going to be February 15th, 5:30 at the Booth Bay Fire Station, where this was last time. Jen's made a bunch of papers here to sign up for different items. We decided instead of a potluck that we'd go with, similar to a harvest dinner, meat, potatoes, vegetables, and desserts. So we can go with all kinds of different meat dishes, turkey, ham, meatloaf, of course, pork, chicken, spare ribs, anything in that order that's a meat. Vegetables, any kind of just plain vegetables, casseroles, potatoes, could be potato salad, mashed potatoes, scallop potatoes, au gratin, anything that's a casserole type like that that we could put out. Desserts, of course, we want pies and cakes and brownies, and if we have enough, we'll have a table like we did last time.
Everything's gonna be hot.
Yeah, hopefully.
Well.
We have a few incidentals we'll need to.
The meats that we're actually hoping to have are ham, turkey, meatloaf, chicken, and pork. All hot. I mean, it can be chicken you've baked and just taken the chicken off, or, I don't know.
Yeah,
Those
that's about it. What we
Yeah.
need is people
Yeah.
to sign up. Now, this is Jenny Brown, and your number is
350-4207.
4207. And my name's Pam Reed, and my number is 633-6223. If you don't want to sign up now, or if any of you
Just
folks
call.
on the television would like to give us a call and sign up for anything.
But we're already asking our friends and.
Yeah. But, you know, I mean, We might not make the 13,000, but we could try, right? Yeah.
Absolutely.
I think that's it.
Yeah.
Anything, we're gonna put posters out,
Press releases.
press releases.
And the donation will be.
Again, bring your wives, husbands, sweethearts,
All of them.
all of them. We'll take anybody that has money.
All the above.
And if you have any other questions, just give us a call.
Thank you. Next under reports, the meeting with LCH and Maine Health. Go ahead.
We met with them again. To me, it's a great thing that we're continuing to talk with these people. I think it was stated earlier by, I don't remember who, but they're absolutely correct, that as we sit here right now, it is still absolutely their intention to change St. Andrews Hospital to a St. Andrews Urgent Care on October 1st. That has not changed. We are continuing to try to put forth to them ideas on why that is not going to be the way it should be, and that we're going to try to change their minds. They're listening to us. I'm not sure they're hearing us. I thought it was a productive meeting. I think, anytime we sit down, that's a positive. We're really going to see things start to move here when we get our report from Ivantage, and we can put it against their report, and we'll sit down and start having some real discussion as to the differences between those two opinions.
They did have some changes.
What's that?
They did have some changes.
Yeah? Go ahead.
Oh, just.
No, please.
Well, they were opening up the beds.
They're talking about that.
Right.
Yeah.
So.
Can you explain that? I found it
They're
very confusing.
discussing, trying to find ways to keep our nursing beds functional.
Yeah, but that's not at the hospital.
Yes.
That's at St. Andrews Village.
No, it's.
No,
It would be through St. Andrews Village, but it would still be in the hospital.
Not according to.
Well, I'm just telling you according to what they
Donovan's
told us.
letter told the employee.
Well, I
They
would.
told us that they add those beds that are there. They actually have those beds there.
At St. Andrews.
What was it,
Yeah.
like 15 more beds or 20 beds or whatever there at St. Andrews. That's there now.
So basically, they want to convert it to a nursing home.
Yeah.
No, I can tell you that, no, that's not what they're up to. But they have to go through the state in order to get those 16 beds remaining there. We went to that, my sister and I went to that meeting on that Friday, and they were very emphatic about that. That's what, it's gonna take them time, they've gotta get through their lawyers, and they've gotta go back to the state in order. It is not gonna be at the village, it's gonna be at exactly where it is right now. And they're looking at doing, again, the end of life and the physical therapy, that's what they're aiming, that's what they're saying.
But they're gonna run it through the license that's in place over at St. Andrews Village.
They have to get the license.
Yeah, but the,
And that is not a slam dunk either.
yeah, no.
Well, I think we reported that at CAD in Greenville, what they did was actually the opposite. Instead of extending a nursing home license to their hospital, they kept their critical access hospital designation and moved the patients there. And that turned out to be more advantageous from a financial standpoint because they then didn't lose their critical access designation, they kept their ER.
Absolutely, and that's what we keep trying to show them, that keeping this as a critical access hospital is beneficial to all concerned.
Yeah.
But as we know at this point, that's not how they see it.
To back up what you said, Smith, they are listening. And to some folks, it doesn't seem like they are, but I feel that they are listening. They are hearing what people are saying. And if you took a look at what was given to us for a plan on July 31st,
Right.
and what we've heard as of the last meeting, there are differences there, folks.
They're different, and they're coming our way.
So, as Smith said, we need to keep talking, we need to keep sitting at the table. I'm sorry if I sound cryptic, but we are working at this. They are listening, we're listening, and it's positive. So we all need to keep an open mind.
Could I add just one thing? I don't know if people know, but if it's brought to their attention, I'm on the board of, at the auxiliary, the hospital auxiliary, and I was not at the last meeting. I believe it was the last meeting that took place, but the auxiliary received a letter from Jim Donovan requesting to buy, because the auxiliary bought this operating room bed, one of the operating tables. He requested to buy it for a certain amount of money, and the auxiliary approved it.
You did approve it.
Yes, I wouldn't have voted for it, but they approved it. And that's not, yeah, that's a fact.
Just for themselves.
I don't know. Ask her.
And I don't know what to say about that, but I think you should know.
So our money is still going to Miles.
No, they're bought, they're gonna pay for it, they're gonna give the money to the auxiliary.
And do what?
Give it back to them, I'm sure.
Yeah.
I'm just frustrated with that part.
Yeah, that's just.
I don't understand what she just said.
That's just an accounting shell game.
What she said, Margaret, was a bed that the auxiliary had donated to St. Andrews.
Bought.
An operating room.
An operating room.
They bought it and gave it to St. Andrew's Hospital.
Right.
According to Jen, the auxiliary received a letter from LCH saying, we will buy this piece of equipment that you bought for us and give you the money for it.
So that way that bed no longer has to stay at St. Andrews. The auxiliary is giving it
There now.
The auxiliary is giving it to St. Andrews, it had to stay at St. Andrews. But if Lincoln County purchases it, then they can send it to Mars if they want.
So once it's their equipment, it's theirs to do as they wish.
Sorry.
No, it's good.
And we are gonna meet with them again. We have a date set up to meet with Lincoln County and Maine Health again after, hopefully, the iVantage report has come out. And that will really start, I think, we'll really start to turn the tide one way or the other, to start seeing where we go, whether then we are looking more at going to the AG's office or to our legal representatives or wherever it may be. But that we'll really hopefully start seeing some movement one way or the other.
But, you know, it was stressed at the public meeting by our attorney and by our iVantage consultants that working with Lincoln County Healthcare and working with Maine Health representatives is going to be our best case scenario. And I still believe that we're here to preserve a community resource. And we need to do that in whatever way we can. And so our first course of action is to work with Lincoln County Healthcare and work with Maine Health. And
Absolutely.
these continued meetings are just starting that relationship so that we can work together, so that we can sit at the table and compare the reports and get the best use out of our report, which we paid a lot of money for, to make sure that they're reading it and taking it into consideration. And I hope that they are at the table for that reason, at the same way that we're at the table for that reason, is to share the information.
Because at the end of the day, guys, what we want is what's best for our communities in healthcare. That's what we want. We want what's going to be best for this region from a healthcare perspective. And we're hoping that they're true to that word as well, because they profess that that's what they're about. I understand the shaking of the heads, believe me, but that is what they put forth, that they are concerned about what is best for the healthcare of this region. And I think once our report is out, it will be interesting to see how they respond to it. It will be very interesting to see how they respond.
I have to say, I think if they didn't care about the health care for the whole peninsula, they wouldn't have ever changed the date from April 1 to October 1. and they wouldn't even consider changing any of the plans that
Yeah.
they set forth on July 31.
And they have.
Yes.
So, we're making progress.
And we're here for the people, and people so far through all the donations we've received, they want the hospital. We know what they want, or we have all this money. I mean, we wouldn't. So let's hope, let's just hope.
We have no old business. New business is the next meeting. It is, my friend Smith reminded me, it's the first and third Tuesday of every month. So our next meeting will be on February 5th at 7 o'clock here at the office. And any comments from anyone this evening before we adjourn? Dan?
Got a question, probably directed to you, Smith. You made the statement that that Booth Bay Harbor and Southport, I don't know about Exxon, we're going to have something on the ballot. Asking the voters.
Right.
If they wanted to keep a critical access hospital.
Right, I'm sorry?
Edgecombe will too.
Yeah.
And Edgecombe too.
And, go ahead.
I think that it would be wise to have the ballot question the same in all
Oh,
four
absolutely,
towns.
absolutely. We've already discussed that. It's going to be the same. And tentatively, what we're looking at is using the same question that was on our petitions. It's going to be essentially that same question. I have talked to the town clerk and tax collector from Southport, and there are some legal things we've got to get cleared up, and not much time to do it, but we're going to do our best to get that on, and I think we can. And if we can get it on, certainly we'll have more than enough time to get it in the other towns. But we're doing our best right now to move that ball down the field and try to get that to happen as of our town meeting. And it will be the same question in all four towns. Yes.
So there's gonna be that question and a question about funding the ambulance increase.
Yeah, this will strictly, the question we're talking about is strictly about, it will be a non-binding vote. I mean, we can't go to Lincoln County and say, well, sorry, it's all over, the towns have voted, you've got to keep St. Andrews open. Which we could do it that way, because it would solve all our problems in a hurry. But it will be a non-binding vote.
Right, but my question is, if you're gonna have two different things for people to vote on, will you fund an additional allocation for the
Yep.
ambulance in
Yep.
the budget? And do you wanna keep a critical access hospital
Exactly.
open? Are you gonna do something to tie those together, as Bruce said in our previous meeting?
No, one is a warrant.
You don't want to tie those two together, Patty? Each year, we already vote on an appropriation for the ambulance
Right.
service. In no way do we want to tie, how do we feel about St. Andrews Hospital with, do you want to fund the ambulance service?
And speaking for Southport, we're gonna have the vote on the critical access hospital done by secret ballot, the same way we're voting for our selectmen in our other office. The issue of the ambulance will come on town meeting on the floor.
Right.
So the two things are gonna be
Yeah.
mutually exclusive.
So I guess where I'm going is that if people understood that if they kept the critical access hospital open, they wouldn't have to pay the additional amount for the
The
ambulance.
huge increase, right?
I understand that voting for the secret ballot question is not gonna preserve the hospital when you go in and talk about the.
All it's really giving us is, right now, there is some discussion by Lincoln County Health that our petitions are slanted and there was peer pressure to get people to sign them.
Oh.
Well, I'm just putting out there what we're trying to overcome. But by doing it this way, there's no peer pressure. People are going into a ballot booth and they're casting their vote. And it can, now, on the other side, we're not gonna get the turnout for these elections that we got at a national election. I mean, but it'll still show the percentage of the people who did vote, how they voted. So.
Mary Ellen.
Hi. On a different note, I just wanted to take a minute to encourage anyone that lives in Booth Bay Harbor or works in Booth Bay Harbor to go onto the town's website and to fill out a comprehensive plan survey. The community and Booth Bay will be doing this comprehensive plan soon, but this takes a broader look at what you want your community to be. And there is a question relating to healthcare, and there is some open-ended questions. But we're really trying to get a better turnout from people that live and work in Booth Bay Harbor. So go onto the town's website and you'll find a link to this. But again, it's going to ask you a lot of questions about other kinds of public services and land use and things like that. But hopefully it will get you thinking again about the future of the town. So I'm plugged in for the town of Booth Bay Harbor.
Jim?
The Chamber of Commerce is trying to put together a public meeting. The Lincoln County Healthcare has put together an advisory group that they're meeting with, trying to come up with ideas. One of the ideas that they came up with was a public meeting in which Lincoln County Healthcare could interact on the topic of the hospital and the emergency room. Not sure how that looks yet. We have set a preliminary date for that. So that's going to be February 27th at 6 p.m. And we're trying to lock down either the elementary school or the high school gymnasium. But I wanted to make sure the task force members had that on their calendars as it becomes available. It should be out there.
27th, did you say, Jim?
That's a Wednesday.
Yeah. Sorry.
Please double check before. Yeah, February 27th.
What time?
It looks like it's going to be 6 p.m. It looks like we're going to try to get one of the gymnasiums, which we're working on that right now. The Chamber of Commerce is trying to host and be a third party. No dog in the fight. Let's get a public meeting, which is just good for the community. So hopefully they'll pull that off, but they're doing it in coordination with Lincoln County Health right now.
Great.
Yes.
Are you looking at me?
Yes, Jim.
Okay. At that meeting, that would be a wonderful time to present a clarification of the role of the ambulance in the town and the other question that's going to be on the ballot, because that'll be covered by the press and everything. If somebody could plan that out to give a statement so that people will understand when and if the hospital does go, the added financial responsibility in each of the towns. I mean, I don't think people realize, the guy in the street, he watches maybe the meetings, but it sort of kind of goes over their heads. And really somebody like you four have really got to make it plain. Make it really plain.
Well, here's what I feel like is an elephant in this room, which is there doubt being cast on that ambulance budget? And who is casting doubt? That budget has gone through the ambulance's budgeting process. That is the budget that they are presenting to these towns. Sure, it's up to the budget committees of each individual town, and it's up to the select board of each individual town to say, we think this is outrageous, we don't think it should be funded. We could say we vote to fund you the same amount as last year. We could say we vote to fund you half of what you're asking. All of these are options that are open. And so if some group is trying to cast doubt that this ambulance service will not cost this amount of money, then people can say, oh, it's inflated, this is not really going to happen, if the hospital closes, it's not really going to cost the taxpayers that much. As of right now, in my mind, that's what it's going to cost. It has gone through BRUS's budgeting process. This is a real number. So when you go to your town meeting and you have to vote on this, in my opinion, at this time, before I've met with our budgeting committee and our select board about the ambulance service, we haven't had our meeting yet with them for the town of Boothbay Harbor. But at this time, I feel that that's a legitimate number, and that's the number that's going to have to go to town meeting.
Amen.
Right. I just think we should say it over and over, I guess. Over and over.
Early and often.
Right.
All right, if there's no one else, I'll entertain a motion to adjourn.
I move we go home.
Second. All those in favor?
Don't forget to sign up for the.
Thank you all.